My name is Rhonda Lumpkin, and I came to meet Dr. B 2 years ago from a industrial accident. I was hit in the mouth by a manager. I had pretty much 3/4 of my mouth knocked out. I didn't know it was that bad, and I didn't know the extent damage that it put on me. It totally lost my self-esteem. I gained almost 200 pounds. I always covered my mouth when I smiled. I didn't want to talk to nobody. I was just went in deep depression and actually tried to commit suicide twice. When I came to see him, I had severe periodontal disease plus the impact of the initial blow that was put upon me. I pretty much had 3/4 of my mouth gone. Dr. Baradaran did 13 implants with me awake. I was numbed. I had maybe had a little bit of swelling, a little bruising, but no pain after at all as I was healing. They started slowly grinding my front teeth and capping them, and then the implants came, and then they put those in, and I had my top smile first. And then my bottom smile came after because my appearance. They wanted me to smile a lot more.
I met Rhonda about a year and a half ago. And unfortunately, she presented with severe periodontal disease. She was in an industrial accident that had severely affected her teeth. And I wanted her to understand the complexity of her case. I needed to make sure that she was knowledgeable as to why I'm doing what I'm doing. And I needed her to be a partner in the treatment process. I soon learned that she could be a patient that I could trust and I could be motivated. And looking back now, a year and a half later, the proof of the pudding is right here. I'm so grateful that she came today to share with us her experience. And actually, I learned some things about you and your experience that I didn't know. You know, we spent a lot of our time trying to prepare the patient, and she had extensive treatment with extractions, bone grafting. She had 13 implants. We made her provisional teeth so that when she left the office, she had something to smile and chew about and be able to go about her normal function. And during the 1.5-year time experience during her treatment, every time she came in, I saw a more positive and happier outlook about her. And she was totally owning it, and she was a full partner with me. And that's the best patient one can ask for, because my success is only good as how well the patient takes care of their teeth. And all her implants took. She was very, very stable. She had minimal discomfort. She had minimal pain during the procedure. You know, many times during these kind of procedures, we put the patients to sleep. But in case of Rhonda, she was never asleep. She was awake just like she is now, and she was just numb. I just gave her some local anesthetic. She was profoundly numb that when I would touch her face or work inside her mouth, she wouldn't feel anything. And I could talk to her and tell her exactly what I'm doing throughout the progress of the treatment. Sometimes her treatment will take 2-3 hours at a time. And you know, we took it at her pace, and she was comfortable, and she allowed me to continue going forward, and we were successful. I'm very, very proud of the amazing woman that she is and what she's done in her life since then. And she's taken this positive energy, and you can just feel it in her. I'm so, so proud. And many patients like yourself are out there who needs this, and they're afraid of having implants drilled in their jawbone. But I think your testimonial is a great proof of how it can be done correctly, thoughtfully, carefully, and to be able to get this wonderful outcome. So I'm very proud.
It doesn't hurt, trust me, it doesn't hurt. It's not as bad as everybody think it is. It doesn't hurt. It's mind over matter, that's all it is. If it wasn't for him, I wouldn't be where I'm at now. I'm gonna start crying because I've got my smile back. I could never smile again. I had my hands covered all the time. I was at a point in my life where it was too dark. And if it wasn't for him, I would not be where I'm at now. And I have to thank him for that. I really do.